a presentation with
Good morning to everybody. Okay. A great thanks to Lars for the invitation, and again my apologies not to be here with you this morning. We're going now to speak about the lessons learned from the EPISAFE collaboration program. The medical administrative databases are an important source of big data to assess the epidemiology of diseases and interventions, to compare drugs, and to investigate rare adverse events. The SNIRAM is a French health system that is one of the largest databases of medical and administrative data for general population. It covers nearly 65 million people and hence provides information at the scale of the entire country, allowing measurement of the impact of changes in practices and new guidelines. What are the data collected with the SNIRAM? There are some demographic data, gender, expectancy, universal health coverage, medical data with disease and accidents recorded, out-of-hospital reimbursement with the date and the drugs prescribed, their name, form, quantity dispensed, hospitalization in over 1,500 hospitals, the entry and release dates, the diagnosis, procedures and surgery performed, and the date of death. The EPISAFE collaboration program aims at assessing the epidemiology and safety of the interventions in ophthalmology. It was set up between 3 French university hospitals, Montpellier, Dijon, and Bordeaux. The first question we tried to assess was the incidence of acute POE after cataract surgery. Over 6 million of eyes were analyzed. We found that the incidence decreased from 2005 to 2014. It was initially from 0.145% and it decreased to 0.053% during this 10-year period. The intracameral antibiotic injection was associated with a lower risk of acute infection, whereas posterior capsule rupture, combined surgery, male sex were associated with a higher risk of acute infection. Here is the histogram from the evolution over time. In A, you have the publication of the ESCRS endophthalmitis study, and in 2012, in B, you have the commercialization in France of an approved preparation of cefuroxime. The second question was to assess the effectiveness and safety of cefuroxime injection for the prevention of POE. A total of over 3,300,000 eyes were analyzed. We didn't find that macular edema was associated with an injection of cefuroxime. And for the patient with capsular rupture, the incidence of POE was lower for those who received the injection of cefuroxime than those who did not. What about macular surgery now? Over 152,000 surgical procedures for membrane removal or macular holes were analyzed. The incidence of POE was 0.25% overall, but it was higher for membrane removals than for macular hole surgery, probably due to the intense vitreous removal for macular surgery. Considering membrane surgery, the 2010-2011 period was associated with a high risk of infection and corresponding to the time to the switch to transconjunctival vitrectomy. What about combined cataract surgery? Over 6 million of eyes underwent phacoemulsification alone, and over 100,000 of eyes underwent cataract surgery associated with other procedures. We found that the incidence of infection after cataract surgery alone was lower than in combined surgeries. What about now the infection with the intravitreal injection of steroids of anti-VEGF agent? Over 1,800,000 injections were performed and analyzed. We found a number of 444 acute infection that were recorded that correspond to an incidence of 0.02%. And the risk of infection was lower in male patients, higher for steroids than for anti-VEGF agents, and higher for non-prefilled syringes of anti-VEGF medication. Finally, is topical antibiotic prophylaxis useful for preventing infection following injection in the vitreous? From 2009 to 2018, all French patients receiving injection of steroids or anti-VEGF agents were included. That represented over 5 million of injection. There were a decreased rate of the prescription of antibiotic prophylaxis over time, with a sharp drop in 2014. We recorded 1,274 cases of acute infection, and fluoroquinolone and aminoglycoside prophylaxis were associated with an increased risk, especially for steroids injection. So, what to conclude? The incidence of endophthalmitis following cataract surgery is rare and was decreased by the systematic use of cefuroxime. Cefuroxime is safe without any macular edema observed following injection. Combined surgery are associated with a higher risk of arm infection than phacoemulsification alone. And membrane removal is associated with a higher risk of infection than macular hole surgery. Concerning intravitreal injection, the risk of infection is higher after injection of steroids than anti-VEGF, and higher with the use of non-prefilled syringes of anti-VEGF. Finally, topical antibiotic following injection should be avoided as it may select more aggressive germs. Thank you.
Well, thank you so much, Marie.